Thank you, Mr. Chairman. And obviously, I rise to oppose the amendment. There's been a lot of talk about this not being affordable, or we're stripping it away from the American people. And I know my colleague from Florida who just got on speaking was talking about it's working in Florida. Well, it's not working in other places. In Oklahoma alone, through the exchange, we saw a 76% increase. In Arizona, last year alone, we had a 116% increase. Why are the premiums skyrocketing? It's because of the mandates from Obamacare. It's not affordable. And our colleagues on the other side know this. So why are they arguing? Why are they having this conversation? We're talking about being honest with the American people. They know it was failing, regardless of who got elected in November, if it was Hillary Clinton or our current President Trump. We were going to be in this hearing room and we're going to have a discussion about health care of the American people. Why is it that all of a sudden this is such a surprise to the other side? Many of my colleagues from the other side came to us and said, hey, we're going to have to work together on this. Are you willing to help us? My question to them was, why? It's yours. It's your baby. You fix it. And I was surprised by the answer that I received. Well, if we don't, we're going to go to a single-payer system. Really? If we're going to be honest with the American people, then let's be honest with our intentions. What's the options here? We know we can't keep it the way it's going. It's not sustainable. Insurers are pulling out of the market. There's fewer choices for the American people. But yet our colleagues on the other side continue to want to argue for a failed policy. Even to the point of saying it cost our colleagues 50 seats, but we stood with it. The American people spoke up and said it's failing. That's why you lost 50 seats. Not because it was the right policy, it's because it was a failed policy. Yet we're still here, and we've been in markup since 10:30 a.m., and we haven't had one single vote. Because of a delay tactic? Maybe it's just because you guys have nothing better to do? I'm not trying to be insulting, but if we're going to get started on fixing something that you know is broke, at what point do we start having an open conversation? I have many friends on the other side of the aisle. I'm open and willing to talk to people when we can have a reasonable conversation. But you can't honestly look at the camera and say that this bill is perfect, that it wasn't failing. You can't honestly say that there's more access and it's more affordable today than it was in 2010. That conversation cannot happen. So what's the option? Do nothing and let it fail? Go to what Plan B was for you guys, to a single-payer system? Or put it back in control of the American people? I think the American people made it very clear. They want control of their health care, not a bunch of bureaucrats in Washington, D.C. With that, I'll yield back.